This podcast is recorded in the land of the Kaurna people here in Adelaide. We pay our respects to the traditional custodians of the lands, waters and communities across Australia on which our members and trainees live and work, and to their elders past and present.
RANZCOG recognises the special status of Māori as tangata whenua in Aotearoa, New Zealand, and is committed to meeting its obligations as Te Tiriti o Waitangi partners.
I'm going to welcome our next speaker to the stage, Dr. Stephanie Trust. She will be presenting the Alison Bush Memorial Oration, How to Promote Community-Focused Sexual Reproductive Health for First Nations Women and Girls. Dr. Stephanie is a Gidja Walmajarri woman who was born and raised in the East Kimberley. She initially trained as an enrolled nurse before converting this to an Aboriginal health worker qualification and worked with Aboriginal medical services in the Kimberley and Pilbara regions for around 12 years. In 2000, Dr. Trust travelled to Perth to fulfil her lifelong dream of becoming a doctor. Dr. Stephanie is a Fellow of the Australian College of General Practitioners with a passion for remote primary healthcare, Aboriginal health and chronic disease management, and is designated Aviation Medical Examiner. She's previously been Medical Director of the Kimberley Aboriginal Medical Services Council, Board Member of the Australian Indigenous Doctors Association, East Metropolitan Health Service and Kimberley Pilbara Medicare Local, and the Kimberley Stolen Generation Aboriginal Corporation. Dr. Stephanie has also been a cultural mentor and advisor for Western Australian General Practice Education and Training. She currently serves on the Rural Health West Board and the South Metropolitan Health Services Board. Most recently, Dr. Stephanie was awarded GP of the Year at the 2024 WA Rural Health Excellence Award. Welcome, Dr. Trust.
Kabua Jiran Manungu, Nyayan Yojari, Nyayan Yuguli, Nyayan Gidja, Nyayan Walmajarri. Hi, my name is Dr. Steph Trust, and that was a very long introduction, and now I know I'm pretty tired. I'd like to acknowledge that we're on beautiful Kaurna country. I'd like to acknowledge our elders, past and present. And today I have the honour of standing here and talking about a beautiful person that I actually got to know myself, Sister Alison Bush. This is a photo of me as a young Aboriginal health worker standing at the back behind Alison. She's in the blue top at the front. And what Alison did was, back in 1994, she started an Aboriginal health worker maternal and child health training program. And that was a program she developed with a lady by the name of Maggie Grant, who's a giant ally that's been a part of the Aboriginal health worker story, who's since passed as well. So I had the pleasure as a young Aboriginal health worker of going over to the James Cook University and studying maternal and child health as an Aboriginal health worker. I got to spend time with her and talk about our shared experiences, both our stories connected through our parents both being part of the stolen generation as well. She was someone that actually inspired me and made me think about, as a young Aboriginal health worker, what I wanted to do with my career and my life. And every now and again, I stop and think about some of the things that happened when I was an Aboriginal health worker sitting and talking to Alison back then. So I hope this talk, it's a personal one. It's a bit more about my journey and what I've been trying to do in terms of carrying the things I learned from Alison way back then. Alison was a trailblazing midwife, and I got the honour of meeting another midwife here just now, an Aboriginal lady. And I'm really pleased to say that my sister-in-law graduated about 18 months ago to being a midwife as well. But Alison came from Nunca in the Northern Territory, and she worked tirelessly to improve Aboriginal maternal and child health right across Australia. She worked at the Royal Prince Alfred, which is where I got to spend some time as well, because the program that we did with them was we went over to James Cook University, learnt on the ground with people from experience. We went back to our communities and practiced what we learnt, and then we got to go and spend time in large hospitals to work alongside the teams in those hospitals. And that invaluable experience still travels with me today as a general practitioner in the work that I do every day in my community. Maggie was an important person in part of this journey, and I think what it reminds me with this photo, it reminds me of the allies we need that walk alongside us with the work we have to do. You're all specialists in your field, and you know and understand the statistics around maternal and child health. And my heart always sinks when I look at the maternal and child health and early education statistics for the Kimberleys, and especially my country in the East Kimberley. So we still have a lot of work to do. What I'm going to do now is talk a little bit about what I've learnt and carried with me going forward. Because when we talk about connected healthcare and the things that we need to do on the ground, it's important that we remember the communities that we're trying to service. So I work for an organisation called Wunan. Wunan is a word that means reciprocity. So essentially, I will support you and you will support me. It's about a coming together. Wunan was an organisation that was started about 28 years ago in the East Kimberley. And my brother actually started the organisation. And what they learned very early on was when you wanted to try and make services for our community what we needed, rather than being reliant on government funding, and rather than being at the mercy of these changing governments and funding rounds, that we needed to build our own wealth. So what they did very early on was start to build their wealth within the organisation. So we have a vast portfolio that we have that includes, office blocks in Canberra and part of a hotel in Darwin and an accounting firm in Perth. And what those organisations do is to be able to be profitable organisations that we can put back into our community. We also obviously apply for programs that look at government programs that we run as well. But the importance is that we can then try, and if we see things and gaps in our communities that we need to fund ourselves, we can look at doing that and build the evidence we need. Because sometimes you, as Nike says, you just got to do it. So what we try to do with our services is Wunan has 6 pillars. Sorry, I don't have my glasses on. But the pillars are around all those social determinants of health. And, I don't need to tell this group how important having a roof over your head and safe relationships and minimising all those issues that can affect our child and maternal health, AOD and other issues around primary health care, how important it is to have good families that are supported in our communities. So what Wunan does is to look at programs that have those pillars around health, education, employment, housing, but also about leadership to change things in terms of the policies and argue with governments or other departments and organisations that we need to get our message across as to what our community needs. We also know that what we do has to be ingrained in what our kinship systems tell us we need to be ingrained in. For example, we do need to have the Wunan way is about that cultural respectiveness, that collaborative, empowering, empathetic and accountable service that we need to deliver to our communities. What we try to do in our organisation is to have a patient journey that's connected. So we also are the lead agency for Headspace in Kununurra, and we're also, within health, we've got a GP clinic. Now, our GP clinic is a private GP clinic. It's for the whole community. We're the only private practice between Darwin and Broome. So we have a vast area of patients that we cover in terms of who we look after at the practice. We are blessed that we have solid O&G services in the Kimberleys, in the East Kimberleys. We have a good network of doctors and midwives. And most importantly, that journey that Alison started for me back in 1994 is one of the most critical things, and that's growing and keeping our Aboriginal health workers and Aboriginal health worker practitioners, whether they want to stay in their roles or whether they want to then use that as a pipeline onto other training. So with our connected services, what we try to do with our patients is to make sure that when they walk in the door that they can access other services if they need to. And I know, we had a program called the Nini Healthy One project up in the Kimberley looking at trying to ensure we had good primary health care. What is the model we need for primary health care for maternal and child health? And one of the big feedbacks that came back from that research was that Aboriginal women wanted Aboriginal health workers involved in their care. And we now see some amazing models that are using that around the country, including the birthing on country and the birthing in community programs that we see around that are doing a fantastic work in this space. I guess for us, what we try to do is think about where our people are, because for a lot of our Aboriginal women, domestic violence and things like that are still an issue. So helping women to look at that and to empower them to move on is something that we need to do within our services. So when someone walks in the door, whether it's at Headspace as a young mum or a pregnant woman or walking into the clinic, that we have all our clinicians know that there are all these other services that our women can be referred to. So, for example, they can go to the financial counsellor if they need that. If housing is an issue, they can start the conversation about safe housing. Or if they're looking at employment, how do we make a pathway for employment to be able to improve the family? So when we're looking at women and children, we're looking at families rather than individual women and children. So we're trying to think about it as a whole of community and whole of family service that we need to provide. So one of the things we've been looking at lately is, when we're looking at community-focused healthcare, we really need a holistic approach that looks at culturally tailored services, that looks at community collaboration, that offers connected care, that promotes peer-led initiatives. And that's actually one of the most critical things we need to think about. And we need to think about how we incorporate education and training to anything we provide on the ground. I recently read a book, it's by Simon Sinek, it's called Start with the Why. Some of you might have heard of it. And it talks about, in the book, about there's two ways to influence human behaviour, either manipulation or inspiration. And Sinek in the book argues that inspiration is more powerful and more sustainable. He also talks about discusses the significance of leadership and the purpose to succeed in life. He also talks about going against the status quo and to find solutions. Because a lot of organisations know what they want to do or how they want to do it, but lots of organisations don't know why they want to do it. And so that was a critical question we asked ourselves as an organisation when we started to look at allied health services in our town. Aboriginal health workers are a critical part of our allied health services. And so we started looking at how would we develop a model that does meet the needs of our community. So in the model, we've got three priority areas. When we started on this journey, we started talking to community first, talking to women and children in our community, talking to families, talking to men, talking to service providers, and asking about what are the services we have currently and why would we want to change what we have at the moment? What is the need to change? And what the next steps would be then how we do that. So we looked at the three priority areas. We wanted to make sure we were going from a surviving to thriving allied health workforce that was diverse and supported. And up the top there, you can see how we wanted to look at doing that. We wanted to grow our own local talent, and that included providing Aboriginal health worker traineeships on the ground and to offer allied health assistant traineeships, so people may want to use that as a stepping stone and a pipeline into then the next steps. This year we'll have a community university hub set up in Kununurra, and that hub will be prioritising healthcare and health education, and that'll be one of the things we want to be looking at as we go forward. Because what I do know is when Alison started that work way back when, there's pockets of that work that's been doing well around the country, but there's pockets where it hasn't done well. So how do we look at that as a region, and then how do we share that knowledge we have to the rest of Australia? The other priority area was that we wanted to make sure we had the right care at the right place at the right time. We wanted it to be high quality and safe. And then we wanted allied health workers, Aboriginal health workers, to be accessible. We also wanted to have enhanced integration, and how do we stop the siloing? Because that's one of the complaints I hear from the community, is to look at how much siloing we have in our community. And I think, I don't know if in terms of the conversations I have with people across the board, it really is about finding out how do we have, the term in GP land was one-stop shops. I don't quite like that word, but it is about how do you integrate care? How do you make it seamless for the women that we look after? The other most critical thing is looking at how do we make cultural safety embedded and important in your organisations. For us, we had to, even though we're an ACO, so an Aboriginal Community Controlled Organisation, we had to stop and really embed this in our own organisation. And how do we do that? And so they're the things these are the themes that came out in the framework that we have developed. And we've developed this with our community and with our staff and with our boards and with our executives, because we need to have buy-in right across the board. Why is cultural safety important? And I'm sure that's probably been discussed many times at forums like this and conferences like this. But down the bottom there, it was interesting just hearing even the welcome to country, because in Gidja, which is my language, so we follow our mother, and in Gidja, you can tell straight away who someone's talking about. If I'm talking about my grandchild from my son, it's different words I use to my grandchildren from my daughter. So it's really important that people understand what sits behind the culture of the community that you're looking after. The one down the bottom is just our kinship system and our skin system, which is very complex. I'm not going to do a test after this talk, but really it's there just to show just how complex it is. Who you can marry, who your brother is, who your sister is, who you can talk to, who you have avoidance relationships with, who you could jump in a car with to come and see the specialist at the clinic, who you can jump and put on an RFDS plane if you're flying them out of Belgo. All of these things, this sits behind that. And our health professionals need to understand this so they have some idea of what is happening, rather than people being labelled as being difficult or potentially. I sit on the South Metro board, so we're often talking about DARMA, so discharge against medical advice. And half the statistics often we're looking at that from an Aboriginal perspective is really lack of understanding around this. I think, the other slide that is up there just is from Creative Spirits, because I think what we always want to highlight, often Aboriginal strengths have been, in terms of what we've brought to this country, is not discussed. I know there's a few new series coming out on SBS and ABC looking at this, and I think it's going to be important that Australians are a part of watching that. Aboriginal people, in terms of medication and medicine, for example, in the East Kimberley, some of the things we know and learn are really important that we are able to pass that on to the wider community. And how can what we know improve things for all Australians and not just Aboriginal Australians? It's really interesting, a lot of the stuff that I've done in terms of running a GP clinic in Kununurra. I run a clinic for the whole community, it's not an Aboriginal medical service. But what I hear from Australians across the board is the way we run things is how they want their health looked after. They want to have culture, they want to be able to be treated respectfully and be able to have connected care. They want to be able to come to the clinic and have a cup of tea, and that we value our elders. So I think that's one of the lessons that Alison and I remember talking about many, many years ago. These last pictures are just about really some of the learnings that we have when out on country. And we have a ceremony we do with our children. And with our children, when they're under 12 months of age, what we do is we have a ceremony where we cover them in respectful medicine. And then we talk, and we have our elders with us, and then we have the families there with them, their brothers, sisters, cousins, mum, dad. And as a part of that ceremony, there's a commitment to help look after that child, to grow that child, and to be there for that child. And as the old people are going down the body, they'll touch their head and say, we don't want you to have bad thoughts. We want you to listen to your parents. We want you to talk good things and talk. So they go through the body as they say this. And that their families are there to witness to that, bear witness to that, and to support that child in their journey in life. So what I'd like to do is encourage you to honour the memory of Sister Bush, her actions, and I try to continue her work. But there's a word that we use up in the Kimberley called lian, which is your GPS, your inner self. Every single person in this room has this. And what I want us to do is think about that lian, that stuff that Alison put into the work that she did. And each of us know when we're doing good things and we're not doing good things, or when we're feeling no good, and that we need to go and do that thing that helps us get back on track, whether it's a cup of coffee with a friend, or walking through the grass with no feet, or going back to country. So it's honouring that for all of us, and to honour the work that Alison did. Thank you.